Good morning students. Today we are going to cover a topic from the pulmonary toxicity, or the topic that is pulmonary toxicity from paper 3 unit 4. So unit 4, it is consisting of the organ toxicity. So we have already discussed about the hepatotoxicity. So what is hepatotoxicity? It is one of the injuries to the liver. So the toxicity of the liver is said to be the hepatotoxicity. Nephrotoxicity means injuries to the kidney, or somewhere where the kidneys is injured. Next is pulmonary toxicity, means the effect of toxic substances on the pulmonary, means lungs. So here lungs. And neurotoxicity means somewhere where it is affecting the central nervous system and the peripheral nervous system. So we have already discussed about the neurotoxicity. Nephrotoxicity means toxic effect of effect of different toxins on the kidney, and hepatotoxicity means effect of toxic substances on the liver. And today we are going to discuss about the pulmonary toxicity. So what are the common examples of the pulmonary toxicants? So we are going to study what are the different type of the toxicants which they use to injure the liver. So injuries caused to the liver. What are the different type of injuries that can cause to the liver, and what are their effects on the body? You know that our body is able to detoxify foreign substances principally through the liver and other organs such as kidney, intestine, and lungs. So these are the different organs of our body, these organs, they normally detoxify the foreign substances. Now coming up to the topic, that is pulmonary toxicity. So what do you mean by pulmonary toxicity? The pulmonary toxicity is the medical name for the side effects on the lungs. So the effects of the different toxicants may be the gases or certain environmental factor, or the medications on the lungs, and their effects, side effects, can be seen on the lungs. So, although most cases of the pulmonary toxicity in the medicines are due to the side effect of the medical drugs. So, most of the pulmonary toxicity is caused due to the medications, or due to the intake of certain medical drug. In many cases can be due to the side effect of radiotherapy. So you can say that these injuries may be caused due to the medicinal drug, it may be due to the radiotherapy, and sometimes the non-medical causes. Such can be chemical compound, exposure to the chemical compounds, and airborne particulate matter. So these are the different sources by which the lungs are exposed and they get injured. So you know that our respiratory tract is consisting of the upper respiratory tract. This is the upper respiratory tract that is consisting of nose, where inhalation can take place, and the lower respiratory tracts, which includes the alveoli or the pulmonary veins, etc., etc. They are said to be the lower respiratory tracts. And the main function, the essential function of the respiratory system in transporting the atmospheric oxygen. What is the main function? Transporting the atmospheric oxygen to the bloodstream. So this is the main function of the lungs. So what is the main function? It is the essential function of the respiratory system in transporting the atmospheric oxygen to the bloodstream. So here, by means of the upper respiratory tract, oxygen is inhaled and then it is mixed with the blood, and that blood is now transported to the different part of the body. Coming up to the factors, so normally the factors which are contributing to the increased risk of occupational and environmental lung diseases includes occupational exposure to the unsafe chemicals. So when a person is subjected to the unsafe chemicals such as certain gases which are hazardous or certain dust and fibers continuously, then these lungs get injured. Sometimes smoking or frequent exposure to the second-hand smoke, they may also cause the lung injury. Now coming up to the respiratory tract injury from the gases and vapors. So as we have already discussed, when a person is subjected to certain chemicals, dust and fibers or certain type of smoke, then lungs they used to get injured. So the respiratory tract of the gases and vapors is determined for several different physical and chemical properties. These factors include chemical doses. So there are the various respiratory toxins or gases होते हैं. They may include the chemical doses, water solubility, yeah, we can say that hydrophobicity versus lipophilicity and the chemical reactivity. So you can say that the respiratory tract injury may be caused of the by the three sources. First one is the chemical doses, second is the water solubility, and third one is the chemical reactivity. So what are the different type of gases which are dangerous for the lungs, and when they are inhaled they cause the injury. So the occupational exposure to gases, when a person is on the site, there are certain gases they used to liberate it from the industry, and when they are exposed to these gases continuously, such as chlorine, such as ammonia. So you can see ammonia, these are the certain gases which is liberated from the industry, from the you can say that chemical industry, fertilizer industry, and the HCl. So these are the certain gases which when liberated they cause the lung injury, and it can be divided into three level of dose exposures that directly correlates to the degree of airways injury and severity of the symptoms. So we can find out certain examples of the gases which injure the liver, injure the lungs. These are chlorine. First one is the chlorine, next is the formaldehyde, next HCl, ammonia, phosgenes. So if you heard of it, phosgenes, it is normally associated with it is one of the poisonous gases normally released from the industry or pesticide industry, where you know that in case of the fertilizer or pesticide industry, certain chemicals, hazardous chemicals are utilized in order to kill the insecticides. So when these insecticides are exposed to the human beings, or when preparation these gases are liberated, and when they are exposed the lungs get damaged. So phosgene is nothing but a toxic gas, or you can say that a poisonous gas. Next is the ozone, nitrogen dioxide and sulfur dioxide. So these are the different gases which are very dangerous. When they are exposed to a person continuously, they may damage the lungs. So drugs can cause the lung injury also. So besides the environmental factors, certain drugs, certain medication, if it is given to a certain patient, then also lung can be injured. So certain chemotherapeutic drugs can adversely affect the lungs. But the drug most commonly implicated in the lung toxicity are bleomycin. It is said that certain drugs which are very dangerous for the lungs are bleomycin, carmustine, and busulfan. Yeah, you can say busulfan, busulfan, and the cyclophosphamide. So these are the certain chemicals which are toxic or they are very injurious to the lungs. So always remember that before taking any drug, always go for the ingredient. If a particular dose contains certain ingredient or a chemical constituent of bleomycin या फिर phosphamide or busulfan, then you must avoid taking that drug. So certain drugs are also very injurious to the lungs, and if these drugs are taken continuously or for the medication, then it is very dangerous to the lungs. Here the lung injury normally includes the pulmonary fibrosis. Pulmonary fibrosis. Pulmonary means lungs and fibrosis means scarring. So the pulmonary fibrosis means scarring of the lungs. So pulmonary fibrosis is a lung disease that occurs when lungs become damaged and scared. So when these soft tissues of the lungs get converted into the hard tissues, when the lungs tissues not able to breathe in or does not able to expand the cells while breathing, inhaling, and contract while exhaling, then we can say that breathing related problems occurs. So lung fibrosis or pulmonary fibrosis is a lung disease, एक प्रकार का ऐसा disease है which occurs in the lung tissues, which this diseases या lung fibrosis या pulmonary fibrosis occurs within the lung tissues में occur करता है and it damages the tissues. This thickened, what does this does? Pulmonary fibrosis, this thickens, stiffens the tissue and make it more difficult for your lungs to work properly. So if the tissues become hard, it becomes thickened, then it is not able to contract or expand more easily, or not able to breathe in and breathe out so easily. So it interferes with the function of the lungs. So as a pulmonary fibrosis person, you become progressively more short of breath. So breathing cannot be possible because it stiffens the tissues of the lungs. And the scarring associated with the pulmonary fibrosis can caused by a multitude of the factors. So हे जो scarring है that can be caused by many factors, but in most cases doctors can't pinpoint what causing the problem. When the cause cannot be found, the condition is termed idiopathic pulmonary fibrosis. It is said that कि ये जो स्केरिंग का जो प्रोसेस है या फिर लंग इंजरी है, that is thickening or stiffening of the pulmonary lungs takes place, sometimes it is not detected, and that case is said to be the pinpoint, means, or you can say that they pinpoint problems, or certain doctors they are not going to identify, or they are not able to identify what is the main problem, but when a cause cannot be found, the condition is termed as idiopathic pulmonary fibrosis. So if they are not going to find out the cause, किसके कारण यहाँ thickening of the lungs takes place हुआ है, तो then this condition is said to be the idiopathic. And the lung damages cause the pulmonary fibrosis can't repair. इसको हम ऐसा है, if these organs, if you take any of the organ which detoxifies your toxic substances, either the kidney or either the lungs, either the liver or the intestine, these part when organ, or you can say that the organ when get damaged, it cannot be repaired. But medications and therapies can sometimes help ease symptoms and improve quality of the life. So it is said that if these tissues are damaged, it cannot be repaired. But if the medication is taken, or if it is diagnosed properly and then certain therapies is taken, then the particular lifespan of these cells can be improved. For example, for some people a lung transplant might be appropriate. So once these tissues are damaged, then it cannot be repaired. So occupational and environmental factors, they are long-term exposure to a number of toxicants and pollutants can damage your lungs. So what are occupational and environmental factors? These are the factors which injure the lungs, and these factors are long-term exposure. मतलब सिर्फ एक दिन के लिए आप expose हो and you can say that I am affected from the lung injury. So it's not like that. So it is that key when these environmental factors, when they are subjected to a person, when they are exposed to a person number of times, then these toxin effects can be seen. And then these pollutants, they can damage the lungs. For example, for silica dust या asbestos fiber, hard metal dust या फिर coal dust. So the people or the person who are working on the workplace, some consider some person which are working on the silica dust या फिर silica related industry, where manufacturing industry, then these people, there may be chances that if they not utilize certain PEP, then they may come in contact with this dust and they may cause this lung effects or lung injuries. So in this way we have covered the organ toxicity, that is the how the different toxic component which is released in the atmosphere, they may, or pollutants, environmental factors, how the different environmental factors they can affect the different organ of our body. Thank you. See you tomorrow.